Swag in the fur coat. Always got the fam real close. Snapchat in the Lambo. How fast is you gon' go?
Hey guys, thank you so much for joining me. Like, you guys are incredible. The love is real. Like, I'm about to hit 1K. Like, y'all, I feel really blessed and absolutely privileged. So once again, I just want to say thank you. Now, I got a couple of questions about what it was like to be a new grad. So I decided to do a little series on new grad. And since I'm no longer new grad, I just feel like I can better share my frustrations in a well articulated, not crazy, you know, way. So anyway, let's begin. So first off, if you're digging the hair, see growth. Yes, I'm really excited that my hair is flourishing. This is not a perm, it was straight. And if you want to know how I got it like this, be sure and like and put it in the comments. There we go. So that way, if you guys are interested on more hair videos, you know, I'll give it to you. But for right now, let's talk new grad orientation. So I'm going to speak from what my experience was. Now, the facility I worked for was a small facility, and so our new grad orientation was different than a lot of my friends. But basically, I was in orientation for about 5 or 6 months, give or take, and honestly, it was all very overwhelming. That is the word I will use. It was overwhelming because I sat and I took my NCLEX on a Wednesday, and then I started work on a Monday, you know. And so your first couple of months is spent in the classroom. You're gonna learn how the policies and procedures go. You're gonna get your badge. It's basically you're doing 8 to 5, and it's very hard. It's very boring. Like, I've never sat somewhere from 8 to 5. Like, my brain was going crazy. Okay, the inner child in me was like, bruh, I'm finna burn this place down. Like, inner child in me was going nuts. But those, you know, that month or so in that class is very important because it gives you refreshers. They do like a lot of skills check off, like IV insertion, suctioning, CPR. They do all of that, which is so fundamental because now, you know, you took your NCLEX, you graduated school, so it may have been a couple of weeks or months, so you do need that refresher course, and that is very beneficial. So now that you've moved from straight classroom, usually after like 2.5 months, they switch you to a hybrid. So you're going to work on the floor, then have class intermittent. For me, I knew that I was going to work night shift, but they trained me on day shift. So for day shift, you walk onto the floor, of course, your new meat, your fresh meat, they're prowling, they're seeing how they can get you, you know, because nurses do eat their young, it happens, you know, but only the strong survive, so we don't, you know, back down without a fight, all right? So, just, you get accustomed and acclimated to what your unit is like. Usually you have a preceptor. So my preceptor, I don't know if they knew that I was African because on first glance, you can't really tell because I'm not accented. But all my Niger brothers, all my Africans, you can tell looking at me, oh yeah, she's Nigerian. But a lot of people, if you look at me, they're like, oh, okay, I don't really know. She's just, you know, African American. But nonetheless, they paired me with this Ghanaian nurse, and, you know, we click like this. This is auntie, this is mama, you know. And I really loved working with her because she was way older, experienced, just excellent in her work ethic. But at the same time, she was one of those nurses who was like, hey, if there's new policies, new things I want to learn, teach me. And I was like blown away because it's rare to find those nurses who have been nurses for like 20, 25 plus years who don't mind being corrected. And that's what I really loved. And when I would mess up and be like, okay, I hung the antibiotic, but I didn't unclamp it, so basically the patient got no medication, she wouldn't be like, oh, I'm telling her. She'd be like, hey, she'll look at me like, hey, are you sure you did everything? And I'll be like, wait a minute. Oh, she was right there checking behind me, making sure that every little thing was done. So like, that was a very good preceptor, and it was really great. And then I had an opportunity to do precept with this little short, little fine Asian thing, you know, who's not my friend. But yeah, I had the opportunity to precept with her, and she had gotten off orientation not too long ago. So it was really good to see how she, you know, how she handles being young and still confident and making the patient know that she knows what she's doing. So I precepted with her for like a day or like maybe 2 shifts, and I was just like, oh, so that's how she does it. Okay, let me take some notes. Bam, you know, this is what I'm going to do. And I really like that. And the way the program worked is that they encouraged you to take on the whole load of patients. At first, when I heard that, I said, me, 5 patients, are you mad? Like, you must have lost your mind. But the way I tell my preceptor, because it's important to have an understanding with your preceptor what is too much, what you can handle, when you need to be pushed, because your preceptor will basically low-key mold you. So it's important that you have a great relationship with your preceptor. So I told her, I was just like, look, I'm not gonna start out with 5. I don't know who they think I am, but I'm not the one, okay? And so what I did was I started out with like 2 patients. Maybe like the first week I tried it on 1 patient, then the next week I tried it on 2 patients and cared for 1 by myself, then so on and so forth, till I finally got all 5 patients, tried on all 5 patients. All she did was sit there and, you know, check after my work and check after this, and that to me really helped me in my time management. So then after like about, you know, a month or 2 or maybe 3 of precepting in a wonderful day shift where I hated it because it was a hot mess and a half, I finally got the opportunity to chunk the deuce and go to night shift. Night shift to me was absolutely incredible. I love it, I love it, I love it. I won't do it forever, but you know, I really love night shift. And then I precepted again with another nurse, and she was amazing. Of course, all these older nurses, like, shout out to you guys. Thank you so much. Like, the knowledge that you guys have is unbelievable. Like, on point assessments, on point, like, thinking ahead, solving problems before they happen. Like, that is what I appreciate about the older nurses. Coming from a newbie nurse, like, I just want to let you know that you guys are just a great tool, and you guys are so knowledgeable. So I love working with them. After training with these preceptors, I think my manager was like, oh, are you ready to be by yourself? I was like, no, because I liked it. I love the comfort of having someone with me, you know, someone right there. I didn't want to be by myself. I love having a buddy, but it was time for me to move on. So finally, I started working by myself, and it was a rough couple of shifts because I forgot this, I forgot that. I didn't do this assessment. I didn't call this doctor. But after a while, you get the hang of it. You either sink or swim. And so I swam, and I'm here now. But all that being said, orientation and all is it's a lot. Orientation is just a time of growing. It's a time of asking questions. Like, ask a ton of questions, because your excuse is, I'm a new nurse, I'm new to the policy, and they can't hold that against you. Like, it's better to ask questions than be that dumb nurse, because they are dumb nurses. Be that dumb nurse that puts patient in danger. You do not want to be that nurse. So with your orientation, couple of things: make sure that you and your preceptor are on good terms, that your preceptor understands how best to teach you. Make sure you're always asking questions, and if you're uncomfortable, say so, speak up. Okay, well, that is all I have for you today. Be sure to subscribe, comment below if you're digging the new hair. It's gonna revert. Like, we're not doing this. Straight hair is not for me. Kinks and curls are my thing, and they finna be coming back and popping. Okay, and I think for 1K I want to do a giveaway. So also comment below what type of giveaway would you be interested in, and I think that is it. So you guys have a great day. I will see you guys next time.
in the fur coat. Always got the family close. Snapchat in the Lambo. How fast is you gon' go?